I want to give you an update on a video that I'd done earlier, a subject matter that I'd done, because a lot has happened since then. For years, the rage in hip implant litigation was metal-on-metal bearing surfaces. And to orient you with that, that's basically where you have one piece large metal head and a one piece large metal cup, both made out of chromium and cobalt, so that the hip, when it's implanted in the patient, looks like this and it moves like this. What was found in those, and almost every company made one of these, and almost every company's gone through major litigations over this issue, is that these two parts, when they rub together, give off chromium and cobalt wear debris. That wear debris is toxic to tissue, and so the thing has to come out. What we're finding now, and what I gave you the earlier video on the subject of, is trunnion failure. Trunnion failure is almost the same problem, but at a different location. These stems are typically made out of titanium, and heads are typically made out of chromium and cobalt. When you put the titanium stem in the chrome cobalt head, there is what we call a taper interface here that creates a crevice. Regardless of the fact it feels it's tight, there's always a small gap in there. Biologic material gets in there, and if you have movement there with these large heads, which create a lot of torque, that starts a process called fretting corrosion, and metal debris can be given off into the tissues from these metal heads, and that poisons the patient just like the metal-on-metal device does, and the patient has to undergo an unnecessary revision surgery. What we're seeing now are tapers, which typically are really nice and cylindrical, symmetric and cylindrical. What we're seeing now is cases come to us where the taper, when taken out of the patient, this is an actual explant out of a patient. This is a brand new taper. We're seeing tapers that come to us looking like this. What's happened in this case is the metal head that was originally on this, and this is the metal head that came out of this patient, that metal head started to corrode. As a result of that, the dimensions of the taper change, and so you start getting motion. There was so much motion in this patient that this metal head started to wobble like this and actually wore these very large grooves in the taper of this device where it almost looks like you put it on a grinder. Unfortunately for those patients, what we typically see happen is they crumble in a heap, they fall onto the ground, the doctors think they've dislocated, and when they shoot an x-ray of the hip, they find out that they have actually dissociated. The ball has come completely off of the trunnion, and it's in the patient's hip somewhere. Sometimes it migrates around to the patient's groin in the front. And then this really sharp device is either still inside the acetabular shell, this plastic shell, or it actually has come out of that and is poking into the patient's tissues. This particular device, this is the shell that came out, and once the metal head came off, it actually wore a groove in this polyethylene liner here. So in this particular patient, all of the parts of the hip had to come out. The shell had to come out, the liner had to come out, the head had to come out, and then the very aggressive surgery necessary to take out a very well ingrown femoral stem. We're starting to see this more and more frequently. I probably have over 150 trunnion corrosion cases. That's where the head stays on there. It just corrodes and causes the metal debris to get into the hip tissue. But we're starting to see more and more of these. And they are coming from different doctors, across different manufacturers, across the country, different locations. So there's no rhyme or reason to why this is happening other than taper design. As I said in the earlier video I did on this subject, the ASTM, which is a group of engineers that actually have some membership who are doctors, study device design. Well, I told you they were looking at this issue, and since that time I've been provided with this book because I'm a member of the ASTM. It's nice and thick. It has a bunch of scientific presentations in it. I attended the meeting where all these things were discussed, but they've now published this book called Modularity and Tapers in Total Joint Replacement Devices. The vast majority of this book is devoted to studying the issue of why this is happening and why this is happening. Why are we having failures at this trunnion and why is this giving off all of this metal wear debris, and how do we prevent it in the future? What I can say to you is, for problems like this, every client I've had that had that problem to date didn't even know they had a problem until pretty close to when the thing came off, the head came off the device. The other patients I have where we have this problem here, the patients can go to the doctor many times complaining of all the same problems that we knew about back in the metal-on-metal days. Pain in the hip, trouble getting around, limited mobility. And unfortunately for these patients these days, if it's not a recall device or it's not a metal-on-metal, the doctors sometimes don't get the diagnosis right for a long time. Patients complaining of pain, the diagnostic workup, first the doctor looks at the device and says it's in there right, it doesn't look like it's loose, it hasn't migrated, so they think maybe you've just got some bursitis. They give you an injection, you come back, you're still in pain. Then they start thinking about infection. They might aspirate the hip and look to see if there's an infection. There's no infection. Then they start thinking of other joints. Maybe it's your knees, maybe it's your back. They send you to other doctors. That turns out to be sort of a non-issue. So now you're back at the doctor's office and the doctor has no clue what's going on with you. What you really need is a chromium cobalt blood test and a MARS MRI. MARS standing for Metal Artifact Reduction Sequence. In the old days, if they did an MRI scan of a metal joint, you couldn't really read it because of all the metal artifact that was given off. There's a new technique now that allows doctors to look at the soft tissues in the hip without all that metal artifact, and that allows them to see if there's any abnormal fluid collection or abnormal growth of tissue around the hip, which is typical of metal wear disease. So for those folks out there that don't have a recalled hip, or they have a hip that's plastic, metal on plastic, all the things that gives the doctors some comfort that you don't have a metal wear disease problem, it's not that simple. If you have the problems that go on for a long time, you need that metal wear disease workup.